this question, right? Are there any doubts, when it comes to our divisions, what we see in our divisions, what we see so far as utilization of resources? Are there questions about what we have at our disposal? COVID and what's been kind of going on has definitely been an emotional roller coaster. I can just speak to that, once again, for myself personally. So we definitely want to be cognizant of that. We're not fully out of the clear yet. There's been a lot of things that have happened. There's been a lot of adaptations and changes that had to have been made in divisions. So we're getting back to kind of a base of normalcy, but there is still the emotions of things that have happened over periods of time. So we're going to definitely touch on a lot of that today. We do have our agenda. I hope everybody had a chance to take a look at it. And we'll definitely be kind of looking for feedback as we go along. And now with that kind of said, we'll kind of get into the Wellness Council and the Health and Safety Council and kind of what we're proposing to do with those moving forward. Kathy, did you want to speak first on that?
Sure. Can you hear me?
Yes.
Oh, great. Good morning, everyone. So we've had some discussion, and as Michael said, in the spirit of powering progress, one of the things we wanted to do is, and we've talked about this before, if some of you have been around for many years like us, we're thinking that at the enterprise level, it would be much more productive and valuable for the people involved to bring those two councils at the enterprise level together. Because what we're finding is the same people that are on the enterprise-wide Health and Safety Council are also on the Wellness Council. So why not bring this group together and get rid of that duplicate effort there and make us, much more integrated? We've been trying to make that connection better with health, safety, and well-being, and doing that at the higher level would really, I think, streamline and make us more effective in delivering our messages. So we wanted to open it up for discussion with all of you and get your feedback. Again, we wouldn't disrupt what's being done at the lines of business or the local levels. Like customer ops has their own wellness council. If you feel that works for you, that's up to you. But at the highest level, we'd like to move in that direction. We've just socializing it now, talked with Michael, talked with Mike Vega as well, and have gotten their support. Of course, we have to go back to the union leaders. We've talked to some management folks, and there too, we've gotten their support. So, but we want to know how you feel about it. So feel free to unmute and chime in.
And I'll just kind of say something to speak to that a little bit, just about kind of the conversation we all had, Mike Vega, Amanda, Jen, Kathy, and myself. A lot of times, like Kathy's kind of saying, you can get things that are lost in translation between, councils. So once again, this is on a higher level. This doesn't affect what you're doing in your local locations or with your local work groups. But it is a way to kind of consolidate so that you're getting one consistent message also. Just want people to kind of think about that. But, once again, we're looking for feedback and how people generally feel about it. So please feel free to chime in and let us know. We got one yes vote.
Thanks, Mike.
Yes, it's nobody else is chiming in. I'll just speak on it a little bit real quick too. And like I said, everything everybody said, we want to get everybody together on the same page. And wellness goes together hand in hand with health and safety. So if you're well, you're feeling well, your body's feeling well, there's less chances of something happening on the safety side. You're a little more alert, you're a little more paying attention, your body's better, less strains and sprains and trips and falls, and stuff like that. So, I started off as a wellness rep, so I'm throwing my support behind it 100%, and I'm anything I can do to help, and I'm always here, and I'm looking forward to getting this done and getting everybody on the enterprise level, and I'm sure we'll talk about it next week on the next enterprise meeting as well too, and looking forward to have everybody come together as a team and work and do what we can do to make everybody safer.
Hey, thanks for that, Mike. I just kind of see a couple questions in the chat. We can definitely discuss the frequency of the meetings, and we can kind of bring that to everybody. In my mind, the way, and I'm just going to kind of personally say the way I see it, we would at least definitely quarterly meet, like we have been doing. But if it needs to be more frequent, we can definitely discuss that. But I think that's kind of like the base. In my opinion, that's the base where you start.
Yes, so this is also where my brain goes, because like so many of my friends out there, we're all like, well, what's the operational aspect of that? So the goal is, I think we can all jointly agree that the amazing goal would be to have meetings more similar to the meetings we had in the past, having full day meetings. And now we have a new hybrid option, but having an in-person option in Edison, while also still continuing to have the hybrid remote option for those who are maybe in Long Island. Larry doesn't always love a commute. Our nuclear friends wouldn't have to make that trip up every time if they didn't want to. So, there's more time period. We use 90 minutes here because of the environment we're in. And we know that you can't stare at your screen for like more than 90 minutes without wanting to not do it anymore. So the goal is go back to a full day, which then allows way more time. And to be honest with my safety friends like Jack and Bridget, a lot of the safety council meeting was the same agenda as the wellness council meeting. There was a lot of overlap there to begin with. And so this sort of streamlines that overlap to start with. And then as we work through these processes, we'll be able to see, we're going to work on this part for the safety council, but it's important that those wellness reps are aware and alert to that, because they're also part of the grassroots effort to support that. And then vice versa, as we're working on something for, a wellness initiative, the safety reps being aware, alert, and part of that also makes them part of the grassroots effort. So overall, as the team has said, I foresee that it would be a more streamlined, and like Mikey Vega said, one mission, one goal.
Also,
Thanks,
I see a question regarding, I guess, the agenda. I would assume the agenda is going to stay the same. It's up, once again, it is up to discussion, up for discussion, but I do foresee the agenda being the same kind of as what we've composed, once again, in person, and what you've seen just regarding the Zoom meetings. So. Was there anybody else that wanted to chime in and
Mike, there's just one other thing that I just wanted to mention. Oh, and Wolf's here too. He might have a few words. We, as you can see by the number of folks that are on the line here, we have lost our people along the way through COVID, in terms of being involved here and engaged. So we're going to try to do an effort to outreach and figure out who those people are. And I think it'll make it easier too, once we do have the okay that we're going to come together at the enterprise level to figure that all out. So we hope to do some of that work over the upcoming month or so. Another thing that is swirling is pending COVID, of course, is perhaps bringing us together as one Health, Safety, and Wellbeing Council in June. as part of a bigger event and possibly signing the commitment statement and doing that whole effort again. We haven't done that since before COVID. So we're working on these things. If any of you have any thoughts or ideas, please reach out to us, because we're trying to do some planning there. And Walt, I don't know if you had any comments.
Yeah, I do. And I'm sorry I missed the first few minutes due to the utility call. But everything I heard, I agree with so far. I think that re-energizing both councils will be an outcome of this effort, and I think that's really, really needed. I know for me, 2 years sitting behind a screen dealing with COVID and still my regular job, I'm ready to get this council going, and I see that the efforts that you saw, the email hopefully from Stephanie Olekson with the mental health and the well-being and all the activity around that. There's just so much overlap between the two councils that we could all benefit from and really juice this up. And it won't deter the individual efforts that are going on between safety and well-being and wellness. But I just think there's so much to gain here that it would really be a positive thing. Getting back in person, if that's comfortable for folks, that's another huge step forward that I think we'll all benefit from. We have new people on here, on the councils, on both councils, who haven't met each other in person. So there's, that'll be pretty cool. And like Kathy said, or Amanda said, the agendas, for the most part, we're very similar. So it just makes sense that we can put all our efforts together for at least for these sessions and really and make a difference. So I think it's a great idea, and I fully support it going forward.
Thank you for that, Walt. And I definitely agree. Once again, just with our local councils, I know for us in Southern, meeting back in person was definitely a significant improvement to the meetings. So far as just, people speaking out about issues and things of that nature. So definitely we will evaluate that moving forward. Did anybody else have any other comments about what we just kind of discussed?
Hey, I'm sorry. This is Christian Morgan. I jumped on in the middle of your conversation. I didn't want to interrupt, just to try to understand what everyone was saying. I just wanted to say that if you, it sounds like you're creating an LOB or whatever along lines for yourself. So if I might have to jump off. So if anybody should need anything from me or any, I started this in the middle of COVID, so I'm still learning everything, and I'm still learning everybody's name, and I haven't met everyone yet. But if anyone should need anything from my side, I can gladly help.
Appreciate that, Christian. Did anybody have anything else? Okay, with that said, now we'll get into powering your emotional well-being. Kathy?
Hi. So again, good morning, everyone. As all of you have felt through COVID in one way, shape, or form, our emotional well-being has taken a really hard hit over the past couple of years, all of us, at different levels. And we are seeing that. We're seeing that at work. We're seeing it with our coworkers, our friends, our family. And we're seeing it in a lot of our survey data. I'll share some of that with you. So with that, we are going to be doing a focus on emotional well-being moving forward. And as we began this discussion, it was interesting because we had different areas of the company coming to us and saying, we need your help. And so as we were in the process of gathering our information, and we had outreach from Long Island, their union, to say we need your help, and we need to bring this more to life about the resources that we have. We see people suffering with alcoholism, substance abuse, and we don't think that they're getting the right treatment or getting timely treatment. We also had locations like Plainfield Gas come to us and say, we need to have somebody on the ground here on a regular basis to help us. get people to understand what our resources are. And in the meantime, we had senior management coming to us and saying, you really need to train your people managers so that they know where to send people, because they don't understand all the great resources we have. So we sat back for a minute, we took all of this in, and we had other groups that were also coming to us. And what we learned was, we take a look at our employee experience survey. Most of us took that. We saw 25% of our masked and 35% of our union employees really struggling with balancing work and life and coping with stress at work and those demands. We were seeing a 40% increase in our utilization with our EAP programs like Beacon Wellbeing, CCA at Your Service is the Long Island program, and we introduced last year our Virgin Pulse coaching, and we're seeing really great uptick there. But we're not seeing enough people. We know there's more people struggling, and we're not seeing the match to the resources, to the utilization. We know that people are looking at topics that include stress, anxiety, treatment for recovery for substance abuse and alcohol abuse, and just managing their emotions. And we also saw that people were seeking help on their own, but often was prompted by their manager or supervisor, or someone from HR, or even a coworker, a doctor, someone from the union, or even through the Be Well program and the cadence that we regularly have with all of that messaging. But as we sat back for a minute, we said, you know what? We're always putting everything on top of the people managers, but they're not really the entire picture of this support network. The people that are touching our employees and possibly their families' lives include those people managers. It's a very important person. That's someone you see almost day to day. But it also does include HR, our union leaders, our delegate staff, our health and safety professionals, our EBRGs, who hold those regular fantastic meetings, educational sessions, and our Health and Safety and Wellness Council representatives. We rely on you quite a bit to kind of push down a lot of the messaging out there. So you really need to be part of this support network. And we really need to start focusing more holistically on the way this looks. So next slide, please. So we're going to be doing an effort this year, expanding that network and how we're going to communicate. And we're going to do things a little bit differently. It's going to all work in unison if we do this right. And Amanda and I and Jen have been working really hard to do this, as well as Liz from medical. We're going to expand the support network using all of those key groups, providing regular training to them. It will include our people managers and all the folks that we normally see interface on a regular basis. But we're also going to work with our union leaders and our delegates in New Jersey. Long Island is already in process, and educate them about all of the great programs. With you folks, we're going to do that in our health and safety councils. We're going to be getting out there. We're going to invite you to some sessions I'm going to go into in just a minute. We're going to give you some extra tools. We might get old school and do some things like your posters and flyers, but again, they work, especially out in the field, to have that right in your face, to see that hung up in your break rooms or wherever. Something that folks can use in the huddles or tailgates. We'll get creative with our different videos and make them short, sweet, but kind of catch you hopefully at the right time and give you that short, sweet information. And we're going to look to outreach to the family. We're going to try to do a postcard at least twice a year, a mailing to the home, again, highlighting all of these different resources that we do have. And we'll do targeting messaging. We have a new different way that we work. So we have to engage our remote workers, as well as the folks who are on the ground, our field and our operations folks. So it might be a little bit different way that we have to communicate to each one of those groups, and we will. And assuming that our COVID cooperates, we do have a fantastic Be Well ground team And they're out there almost every day the past several weeks, getting out, reaching out, getting to your all hands or council meetings, again, to reinforce all of these great resources that we do have. The next slide. So we're going to kick this off with our support group. We're going to focus on our people managers, our health and safety professionals, and HR. There's going to be a monthly cadence of programs provided by our EAP professionals who, in mental health, who can deliver those messages to provide the right tools, techniques, not be an expert in counseling people, but merely to approach people, to direct people in the right way. And we'll include in all of those sessions that you see there monthly, we'll include different information, a little bit more focus on all of the resources that we do have. So you can see March, we're kicking this off. It'll be more broader emotional well-being guide. In April, recognizing the troubled employee. May, it'll be grieving and loss in the workplace. June, again, will repeat that emotional well-being guide. July will be managing stress, and it'll, again, that difference between working remotely and working on the ground. August, again, the repeat of that emotional well-being guide. September will be suicide awareness and prevention. October, again, grieving and loss in the workplace. November, again, that reinforcement, high-level emotional well-being guide. And December, stress and depression for yourself and how to deal with that. In those sessions, because these are some areas that folks we're seeing is happening. What to do when unable to reach an employee? How do you deal with that? Where do you go? What's the process? What do we do when an employee makes threat of imminent harm to themselves or to others? Unfortunately, we've had some of that as well. How to handle an employee death, including how to make those notifications and what to do there. And then how to meet people where they are, but giving them what they need when they need it in that moment. Next slide. So this slide just gives you a snapshot of the resources that we do have for your emotional well-being. And oftentimes it goes beyond just Horizon Behavioral Health and that network of providers there. The Next Step Consult, which really is a concierge service to direct you and coach you about all the resources that you have available to you. Because sometimes your emotional well-being might be because you're having financial problems, or you're just not happy with the way you look. You put on that 50 some pounds over COVID, you can't get it off and you're feeling lousy about it. That will help you next steps to get there. Health coaching by Virgin Pulse, again, another way to get coaching that you might need. And then of course we have Beacon Wellbeing and CCA at your service, our EAPs there. And Be Well also has all kinds of other programs, just using things like mindfulness, learning how to meditate, how to be more focused and centered. Journeys is another nice program that we have available to you. So this all will come together within all of our messaging. Next slide. This is a snapshot and really just a takeaway for you. I'm not going to go through all of this on the slide. It gives you a little bit more detail of what the program is, who is it available to. For example, our EAPs are really available to all your employees, your family members, anyone in your household, anyone who's impacting your life. It could be a friend that is in trouble, can use our EAP and get up to 6 sessions per issue. They also do a great thing for our folks, our support care network, that organizational support for the critical incidents. You've seen some of that work. Unfortunately, we've experienced a number of deaths of employees, and that's where the EAP gets called in to do that counseling for folks who've had a relationship with that individual that we've lost. So great services there. Some of the Virgin Pulse programs, those are available only to those who are enrolled in Be Well, which for us, fortunately, is the majority. And then the Horizon Behavioral Health is really available to those who are enrolled in medical and their family members as well. And all the contact information is there for you at a glance. And as we go along through the year, we will get more in depth into each one of these areas and give you an opportunity to kind of understand a little bit more what these programs do. The next slide. So this is a snapshot of our timeline. I hope that many of you have taken a moment to read Stephanie Olickson's message, was released on March 17th, and really is kicking off this effort moving forward, and it's a really powerful message. We'll include it with the materials here. If you haven't had a chance to read it, I encourage you to please do so. It kind of brings it all together. March 30th is when we're going to kick off that first session using Beacon Wellbeing and some of our other vendor partners to deliver a really great session, getting us moving and having an overall view of all of our emotional well-being, how-to techniques, solutions, and programs and resources. All of you are invited, if you have a moment, to go to those sessions. I know some of you are out in the field and you don't have an opportunity to do that, but we are going to record those sessions, so they will be available on demand, so you can look at them at your leisure if you would like to. But we will be doing our training, you know, when we have those council meetings, and we'll be doing that, so you're going to get that as well. And then we will have that regular cadence for our employees of the communication. We're going to include all the different channels that we have available to us, whether it be the link or through My PSEG Connect, whether it be through you, our EBRGs, our vendor partners. Our Be Well team is going to be on site, so they'll give you some support there. And of course, you on an ongoing basis will get that information and understand what we'll be doing ahead of time. Next slide. So next step, please take the time, read Stephanie's message. Very, very powerful. We're going to give you invitations to attend the trainings. If not, they'll be recorded. You are an integral part of our support network to move the needle, to reduce the stigma on emotional well-being, and to get folks the help that they need. So we're counting on you. Please share events, reminders, or anything that we're doing as we go along through the year. We're going to get as creative as we possibly can to reach everybody in different ways. And please stay informed. Do take a moment. I know you live busy lives, but please stay informed with all the stuff that we're going to be pushing out on this. And please reach out to myself, Amanda, Jen, the Be Well Ground team, Liz, Walt, any of us, and we will be happy to help you. And with that, thank you, everyone. Oh, a couple things. We've put into the materials here, this guide here, well-being. This has all the programs. There is a QR code, separate one for Long Island and New Jersey. So if you even take this slide and post it around, people can get that whole guide that has all the information on all of our programs. So use it as you can. Anything else in there? Jen? Okay. Any questions? All right, thank you.
Thank you
Here's
for
Sam.
that. Yeah, thank you for that, Kathy.
Good morning, everybody. So for I think everybody knows me, but I'm Sam, your Wellbeing Program Manager from EHE Health. So today I just wanted to talk a little bit about a reminder to get people out to their exam. As a reminder, we are your year-round preventive benefit. that's offered by PSEG. If you are covered on the company-sponsored medical plan, you and your family dependents over 18 years old are able to come in for the EHE exam. And then I always like to highlight, especially being on site, everybody was getting excited about those 3,000 Virgin Pulse points that you do get for completing your exam. And along the lines of even what Kathy was talking about, a small piece that EHE is able to help with emotional well-being is with health mentorship after your exam as well. So that's how EHE can help contribute to that. So health mentorship is basically coaching to help you reach your goals. After you've had your exam, you're eligible for up to a year. So what you can do, Jen, I don't know if we can play the video. You want to try? These were on, this is actually on Virgin Pulse this week. So I wanted to share. It's just clicking over to the next slide, huh? That's okay if it doesn't work.
Meet the original prevention network. We're EHE Health, a different kind of benefit, one that gives you 360-degree preventive health care 365 days a year. With EHE, you can spot health risks, catch problems early, and create better daily habits. It starts with your personalized EHE Health Pulse physical exam at one of our convenient locations across the country. This exam is the only one with 100% of the preventive screenings you need, from vision and hearing to cancer screening and heart health, plus special assessments of nutrition, mental well-being, and more. A traditional physical doesn't give you this much. Need any help with your exercise or eating habits? We provide health coaching all year, and we have you covered in other ways with referrals, vaccinations, and much more. We give you a full picture of your health and the best tools to take care of it, and that means a healthier, longer life. Take advantage of your EHE health benefit today.
Thanks so much, Jen. And when we go back to the slide, I see Cody's question here. How do you schedule EHE exam for family members? You would actually you could visit my.ehe.health or call that phone number on the slide there.
The original prevention network. We're EHE Health, a different kind of benefit.
Yeah, it's playing
one
again.
that gives you
so if you call, or they would have to log in with their email, but it tells you if who's eligible. So that's a great question. Calling is also easy, of course. Thomas, I see your hands raised.
Yeah, I tried to schedule an EHE exam yesterday, and I live in Toms River, New Jersey. Okay. And there's really no location convenient for me to take an exam.
Yeah, so that is an ongoing thing that we are working on. Is we always try to evaluate areas and gaps in coverage to try to attain providers that are as close to where people live as possible. So that is definitely an ongoing thing that we are working on. So I would say if you're open to it, you can keep checking back. I can take that back to, I'm going to take that back to our network team just to let them know. And they actually are always looking for new providers to come on to join the EHE experience. So I will definitely bring that back and hopefully have
awesome. Also, another thing, this you may not be able to help, but maybe at a management level, I did believe I brought it up last meeting about getting some coverage to go get your screening done, whether it could be coverage for the day or coverage for 4 hours, because you can't do a screening on the weekend. So it's only during work hours. Seems to me I could only get a screening during work hours. So I don't know if there's anyone that wants to speak to that.
Is it Kathy or Amanda? I think that's on the PSEG side. Kathy, you're muted.
Kathy or Amanda, anybody?
Sorry. We don't provide time off to go get your preventive exams and screenings. There are EHE providers that have evening hours and Saturday hours too. And I know you're down in Toms River. I'm in Point Pleasant. I go up to the Morristown location. That's one of EHE's clinics, premier clinics. And I would highly encourage you, it's only once a year, to go up there because the experience is great. And I know Sam there too. I think they have some evening hours. I think you're starting to get back into that schedule. And
Yeah.
certainly, yeah, I have to tell you, you won't be disappointed. You're going to be kind of blown away because you're going to get everything right there and then. And it'll take you like 2 hours. If your wife goes, it's like a 5-minute ride and they send you to get her mammography done. It's just a wonderful, wonderful experience. You'll never have so much information about you, probably too much information, but it is so thorough. I mean, from your eyes to your toes, everything is done. And the physicians there sit with you and actually have a conversation and review everything with you. And it's just totally different than I've ever experienced before. So I know it's a little bit of a trek, but make a day of it. Go to the Short Hills Mall and take your wife out for lunch. And
I totally get that. And I would love to go to that Morristown and have all those things done. And with work schedules, and we just had a newborn baby 2 weeks ago, and I'm very familiar with Morristown because that's where our IVF clinic is. So the ride isn't such a big deal, but I feel a lot of employees take a second back seat to getting the EHE done because they don't want to go at night and they don't want to go on weekends, and no one really wants to take a day off of work to get it done. I know we could get 4 hours to get the vaccine, and maybe we could try and present something to just get the 4 hours to go get our physicals done, because it's a really good well-being, health-wise thing for us.
I'll take the idea back. I'll take it back.
Okay, thank you.
And I will say,
Yeah.
Thomas, to your point, Morristown does have Saturday hours. They just are I think they were booked, yesterday I was booking someone and they were booked all the way out through probably like the middle of April. But during the week, we have a lot of availability. But yeah, there are definitely Saturday hours, but yeah, Morristown is great. Thanks. I see everyone's.
And congrats on that baby.
Yes, congratulations.
Thank you. Yes, it was 3 years in the making, and he was 9 pounds, 10 ounces, and he's doing very healthy, and everybody's good on this end. So
Good.
That's amazing.
Congrats. Blessings.
Okay, perfect. So I think there was a question about car service. So there is no car service that takes you to your EHE exam, unfortunately. Okay. So we can go to the next slide, Jen.
There was one more question from our other mic. What is the percentage of employees that take the EHE exam? If you want to share any data points, Sam.
Sure. I'm trying to think of what the percentage actually, because we have the numbers broken out differently. It's okay for me to share. Are you okay, guys? Okay with me sharing?
Yeah, Kath, no issues.
As long as there's no
data
names.
reports before. Yeah.
Oh no, no
Walt.
names, no names.
No.
I'd say probably about. It's hard because we break it. We do see like numbers based on family members as well. So it's higher than employee population, but I would say it's about probably like 10%. So we definitely want to bring that number up if possible, especially because, you know, even being on site, we see that a lot of people just aren't visiting the doctor at all. So just even reminding them whenever we talk about EHE2, especially if people aren't on the medical plan, I just always say, you know, it's just a reminder for you to make sure that you're getting your preventive exam. So it is really important. Okay. So I did want to let you guys know that we are doing a presentation, and to that point where people might not be coming in for their exam, we are doing a presentation on power of prevention, and we're actually going to have one of our physicians, Dr. Lucan, speak about this. I wanted to just show you guys what the flyer is going to look like. Unfortunately, the date was postponed as of this morning. So I did want to let you know that this is coming down the pipeline, but we are really excited to be able to bring you're going to see a little bit more of our physicians, just talking about the importance of prevention and giving statistics and, just giving a little bit more information about the exam and about just your overall health, especially when it comes to prevention. Because unfortunately, a lot of things that can come up at your annual exam might not cause any symptoms. So it is really important to make sure that you are going regularly and encouraging everyone to go regularly, whether it's EHE or their primary care physician. And that's it from me. If nobody else has questions, thank you guys so much. You guys always have such great questions.
Thank you, Sam. So now we'll have, with no other questions, we'll have Be Well Hub. Nick, how you doing, Nick?
Morning, everyone. I'm good, Mike. Thank you for having me, and thank you everyone for coming through. So I'll speak very quickly on this thing that Virgin Pulse and Jen really specifically worked very, very hard to put together. It's called the Be Well Hub. And as a wellness rep, as an advocate for wellness and health, as somebody maybe in a leadership role, this is a great place where a lot of information is housed all in one. So what are some of the resources on there? You can see the bullet points there. I won't read them verbatim. There's going to be information about the ground team, so how to connect with us, learn a little bit more about us, our backgrounds as well, what vendors we represent, always important, right? You want to know who to go to for what. There's also going to be the Be Well Beat on there, which is this new weekly 1 to 2 minute video we do that aligns and correlates with the monthly Be Well theme. And again, it's 60 seconds to maybe 2 minutes, on the maximum long side. So it's great for huddles. It's great for tailgates. Any sort of little short meeting of employees coming together. Be Well Beat is really good because we're not only just taking the theme for the month, but we're doing different pieces of it throughout the month. And what's great is there's a regular cadence for it. You can always depend on it to be there, on Mondays, every single Monday. So if you're meeting with your groups weekly and you want to inject this big piece of wellness into the day-to-day, Be Well Beat's a great way to do it. And like I said, they're recorded far ahead of time. So if you wanted to, you could even go far back, a month back, 2 months back, and play those videos if you wanted to. You play them in order, you can play them out of order, but either way you look at it, everything does align with the normal monthly Be Well themes as is. So any information that's already being distributed to your group, whether it's by you or by the ground team or whomever, it only builds upon that information and reinforces it. So it's something to think about. We have a lot of people coming to us about it and wanting to use it for their huddles and things like that. Also, there's the monthly wellness flyer is on the Be Well Hub. Now, you can use this to just promote wellness around your department, within meetings, around your office. It's really no different than if we were to come on site and hang up, for instance, for me, some Livongo posters, right? Really is no different. And what's great about that is that it gives you a little bit more appreciation for getting that information out, because when you're taking this flyer, either distributing it via email or hanging it up in person, you do see just how far of an impact that communication has, because you're trying to go so far down the web, right? You're trying to reach each and every employee to the highest extent that you can. All of these things help to do that. And again, it's all housed on the Be Well Hub. And what's great about this is that it's on Virgin Pulse. So we're already very, very familiar with Virgin Pulse, and it's under programs. If you just go to view all, you'll see Be Well Hub. You could even search for it if you wanted to. I'm not sure if there's another slide that comes after this. I just want to make sure if there is or not. I don't think so. Nope, that's my piece. Were there any questions on Be Well Hub or any of the information I just gave you? Nope. Okay. All right. Thank you, everyone.
Thank you, Nick. One of the feedback that we did receive was how can we get more information out to those people on the field or who maybe not have PSEG email addresses. So this is a great way to get our Be Well message out to those out on the field by using the programs page with the Be Well Hub. So thank you, Nick.
Thank you, Nick. We appreciate it. No other questions? All right. So now we'll get into exercise rewards. Jen?
Thank you, Mike. This is the last call for 2021 exercise rewards. You have until the 31st to submit your rewards application. And just a tip to make it sure it's all complete, making sure you print out your application, you print out your financial documentation to show proof of payment, and also exercise documentation, either self-reported or printout of your paid service. So for 2021, fitness center memberships, subscription services, outdoor or virtual paid classes, and then other physical engagement activities during the year can be applied, such as virtual personal training or some fitness training apps. To submit your forms, this has been the process for the last 2 years, is through Virgin Pulse. You sign into your Be Well account. You'll hit your support button on the right-hand side of the webpage. On the top menu, you'll choose Send a Form, and then you'll use the drop-down box to submit the form. You want to make sure you scan all your documents together, so it's a one package piece, and this way you won't be denied as they review your application and forms. Okay. Any questions? I'd be happy to help. I was on site helping those submit forms and making sure when you do log into your Virgin Pulse account, when you click for your application, that is specific to you. So please don't print out your form and hand it over to multiple people. There is a number attached to that. Any questions?
There's a question.
We do have a question
in the chat.
Yep, go ahead. You want to read it for her, Mike?
Yeah, it just says Doug says, regarding rewards for subscription services and memberships, are there any discounts on equipment if bought through a specific site like Peloton, for example?
Great question. So equipment is not considered part of exercise rewards, the actual piece of equipment. The membership is. So if you have the Peloton membership, the monthly subscription fee, that's what's included. But for discounts on equipment, check out Horizon. There's Blue 365. There are other different discount programs that we could bring forward to you for equipment discounts.
Any other questions for Jen regarding the exercise rewards?
And I will actually go ahead and share my screen just to show you guys sometimes a nice visual of how to let me just switch my screen over. So you guys are seeing my account from Virgin Pulse here. So to submit your form, like I mentioned, go over to the right-hand side, click on support. And this top toolbar, you'll click send a form. From here, you want to submit the request, submit a form. Any additional details you want to include here, please add in. Type of form, form submit, and you can add your files and hit submit. It's very, very simple to just upload. Just one piece of advice is just making sure you package it all together. Okay.
Thank you, Jen.
You're welcome.
All right. Now we're going to get into the COVID-19 update. Amanda?
That's me. May I have a little screen share? Or I'm just gonna steal it. Do all the things. If you chat to me, I can't see it because I blocked it, but with my screen. So everyone, this may hopefully look familiar. This was an HR Online that went out, I'm blocking out my memories, I think last Tuesday. It was a really long time frame. And this was a wraparound from the Ralph LaRosa message on March 4th, but it was really clarifying and providing some more information on what the CDC's community level means to us here at PS. So you as a human, as a person, can actually access the community level tool, as well as your safety professionals, managers, etc. So you'll understand exactly where we are in the community level. So it's found on the CDC's website. There's a widget on mypscgconnect.com. It's on the PSCG homepage inside on the network. It's on Long Island SharePoint page as well, Larry, but I'm sure you knew that already. So the protocol is that the safety professionals from all lines of business will review their location status on the community level tool and implement any changes to the protocols based on those levels reported. So as we recognize, each county now has its own level. So in Essex County where I live, it could be red, whereas in like Salem County where Doug may live or work, it may be red. So it could be different, green. It could be different between our locations. So that you may find that Southern Division and Palisades Division are totally different things. And that's an expectation I just want to make sure we set is clear. Hold on, I think my ospreys are still making noise and they're confusing me. Okay, so low and medium do not require face coverings regardless of vaccination status. An employee can choose to wear a mask unless otherwise required by the JHA at any time. And they are encouraged to do so, especially in gatherings where physical distancing is challenging. And the CDC does provide some prevention behaviors for low and medium risk levels. A big key here is we still want to use the daily COVID-19 screening questions every single day prior to entering the workplace. And there's a variety of ways you can do that. There is the Virgin Pulse Passport, and I know my friends in customer ops are avid fans of using that as it provides an easy access. But you can also do these questions with a manager, with a designee, when you come into the workplace. The questions are important because it's taking the moment to self-evaluate, how am I feeling today? Is that trickle in the back of my throat new? Is it different? Is it my allergies? It's self-reflection to recognize if you are unwell. If you're unwell, please do not come to the workplace because that is how the disease spreads. So moving on to high, if a county goes into the high risk, the employees in that county will be required to wear a face covering indoors, regardless of vaccination status. So we're all very hopeful that we don't get there, but if Dr. Solomon was here, he would warn us that the 0.2 variant of Omicron is starting to make its way into the United States and is in our area. So, continuing your prevention strategies, hand washing, avoiding interactions that aren't necessary, things that are old habit for us 2 years in will still play into our prevention opportunities. Okay, so that's that. Some other news, which I'm sure you definitely heard because it was the best news of the whole email. And company-sponsored events. All employees, regardless of vaccination status, can attend company-sponsored events. You must follow the vaccine or COVID requirements of the venue or the event holder. Contractors are eligible again following this, but okay, I'm burying the lead. Fitness rooms. All local fitness rooms and on-site gym spaces were able to be reopened upon completion of the pre-opening instructions. The Newark facility is going to remain closed this time until additional review and occupancy is managed. So I wanted to pause. I'm going to bring up the fitness room on-site protocol that Bill Harley and I worked on together. Does anybody have any questions? I know you all eagerly jumped into reopening your fitness centers or your fitness spaces in your space. Any questions about this? You know, I'm your resident employed of PS Fitness Center expert.
Going once, going twice.
Michael, you're always there for me. Okay, so I just want to highlight this. If you do have your fitness room open, when the counties go into high risk, there are protocols for that. Face coverings need to be worn in the fitness area as well, regardless of any exercise being performed. That is in a high risk county. And anytime the counties are in low or medium risk, face coverings are not required, they are optional. Okay, so those are the key features there. Okay, moving on to the last major part, and you're gonna get a bunch of reminders about this still, but you may wanna make sure that your coworkers are aware. There are updates to the temporary paid time off practice that will go into effect on Friday, April 1st. That is next week. So things that are changing. The annual 80-hour pay allotment will be discontinued. This means absences from work that fall into the categories I'm going to mention are no longer covered under the company's temporary paid time off as of April 1st. So these are, if you were COVID positive, if you were directed by a healthcare provider to remain out of work because you have COVID symptoms, or you're recovering from the side effects of a COVID-19 vaccine. You're caring for a family member with COVID diagnosis or taking a family member to obtain a vaccine. If you're caring for a child or parent due to school closure, place of care closure, or care provider unavailability due to COVID-19. Or if you are directed by the hotline to take time off to quarantine because of close contact or personal travel. Those are no longer covered under the 80-hour allotment of temporary PTO. What will be continuing, employees who are scheduled to have a vaccination for COVID during their workday will be provided with 4 hours of paid time off at their regular pay per injection. And there's more details available, more details available at the guidelines, and that's going to be in the emails as well. And just a legal note here, PS will continue to comply with all state and local laws regarding paid time off for all illnesses, including those applicable to COVID-19 related absences. COVID absences will be reviewed to ensure compliance with applicable laws. New Jersey and New York have laws that continue to provide pay and protected leave for certain COVID-19 related absences. That is the end of my legal conversation. If you're living in one of these two states, working in one of these two states, which now is all of us, feel free to check out the links when you get the emails later today to make sure what is still applicable for you by law. And I know we have Larry, the New York City law is still in effect. So that is the end of that. Yeah, so I love a question. Please bring a question.
When you had talked about taking time off for the vaccine shot, isn't it during your EHE exam? Can't you get the vaccine shot? So couldn't you use those 4 hours and do the EHE? I know it sounds weird. It's sort of like a read. I know it's reading between the line of the rules.
You're always thinking.
If I'm getting EHE and I'm getting my vaccine shot, why can't I combine it, right? I don't remember.
Thought. Sam, do we have vaccines available within EHE exams? Would you like to speak to that?
Absolutely. So I will say in the Morristown Clinic, they do have boosters. So if you are getting your booster shot, that is something that is available at the Morristown Clinic. With the other network providers around the state, it's not guaranteed that they have the vaccine. So that would be the difference there. But that's a really great question.
All right, that's the extent to which I can answer that question legally. That was a good question, Mike. Okay. And lastly, hopefully you can still see this as I'm going to load this up. There were a few areas that really didn't have any changes with the protocols. The definition of fully vaccinated is still as we have maintained it. Cafeterias were able to reopen, but we don't have that many cafeterias. And if you're in the general office, again, the occupancy doesn't meet the need for a cafeteria. So there's some other options. Again, my daily COVID-19 screening questions, don't let me down. Do your screening questions every time you're coming on site. Makes me happy. The hotline is still available. So if the screening questions lead you to call the hotline, you can call them, they're there, and they will answer because now they have nobody calling and they miss people. So, you know, if you have to call, they'll take care of it. Domestic and international travel policies have not changed. And as I mentioned already, receipt of vaccination booster shots are still eligible. So that is the end of my my presentation. Any questions I haven't covered? All right, so if you take nothing else away from this, clean your on-site fitness rooms before you let people use them again. End of report.
Thank you, Amanda. Thank you for that. Did anybody have any other questions for Amanda regarding what we just kind of talked about? I mean, once again, we know it's a lot. I know a couple of locations have this information posted kind of all over the place. So definitely reference that material. With that said, now we come to.
Hello.
Oh, go ahead. I'm sorry.
Sorry, guys. Can you hear me? This is Marlon from Clifton.
Hey, how you doing?
Hi, Marlon.
Hi, Amanda. How are you? Question, Amanda. I know this has nothing to do with the gyms. Just a little. Remember the farmer's fridge? I've been actually.
Yeah.
I've been very thinking about it. I wanted to have it for the shops. I don't know if you can let everybody know a little bit about it, but I know we have it in Newark, and this farmer's fridge is like a vending machine that has healthy food. And I get my dispatchers asking me all the time, can we change the food out in the vending machines? Because all it is just candy. We have soda and candy, and we have our street department, and we have shift work that guys come in at 1 to 9, 4 to 12, and you know it's just a healthy option for to have. Any word on that now that you know our restrictions are coming down? How we can get it back into roll so we can get it in some of the shops?
Interesting. It's still sitting in Newark, just empty for 2 years. They follow up with me every once in a while to say, "Are you guys opening again?" And I'm like, "No, don't fill the machine." But yes, let me talk to John Madden, who oversees facilities for the northern region, and I'll broach the subject with him and see if we can get it to go down. So we'll be, you know where to find me, Marlon.
Perfect. Thank you. Yes, thank you.
Yeah. Thanks. I like this. Let's see. I mean, maybe if Farmer's Fridge is willing, then yeah, maybe this is a good opportunity to make that pilot happen.
Yeah, and even if it's not Farmer's Fridge, it's just the idea of having that. I mean, I know there's a lot of companies that are doing it now, and it's just a great thing to have a healthy option, especially at the shops, especially with dispatchers that have no chance to go out, and sometimes at midnights they can't order food. So it's just an extra option that we can have. But yeah, thank you though.
Yeah, and the food's tasty. So that helps too.
Amanda, I have a question. This is Ramona.
Hi, Ramona.
How are you? When the gym in Newark is open, are you still going to have the online classes with Holly? Seeing, I don't think everybody will go back to work at the same time, but the gym will be open. Will we still have online classes?
That is an excellent question that is currently under review. We foresee the hybrid option. Yeah, God is crossing our fingers. To be honest with you, Ramona, we don't know what's going to happen with the facility in Newark if it is going to reopen. The hybrid opportunity is having a lot of ground. So I foresee a hybrid opportunity for quite a while to come. So that's about the extent of what I can answer today. as it is actively being discussed, reviewed, negotiated, et cetera, et cetera.
Okay, thank you.
But thank you for sharing your love of Holly and her classes, because we agree. She's awesome. Anybody else? Story time with Amanda?
Well, with that said, I mean, I agree on kind of the vending machines. I know we've talked about it before, but yeah, it would be great if we could get a healthy option, you know, in the location.
Yeah, start with success in one shop. It'll spread like wildfire. Farmers Fridge wouldn't mind the business because it's basically 100% business for them. So if they buy it, they will bring it.
Mm-hmm.
Yeah.
Yeah. And with that said, now is the time, you know, for our roundtable discussion. Anything, you know, anybody wants to bring to the floor, you know, now is the time. Just want to emphasize to people, you know, we've talked about a lot of things here today. Just make sure that we're getting this information back for our work groups. I know some places are still dealing with the remote aspects. You know, if you have an opportunity, definitely make sure that that information gets out to those people too. Those that don't have access to company email. I know for us, and I'm in the garage, you know, I know that, you know, every once in a while, just when we have time, going through videos so far as the Be Well, and kind of even going through like a walkthrough of Virgin Pulse sometimes, just when people have questions, it has been a beneficial thing. It's been improving, you know, over time. People ask specific questions, and you can always reach out to Amanda and everybody else regarding questions. You know, they always answer, you know, right away. Go ahead, Mike. You have something for Roundtable?
All right, hopefully I didn't double mute myself. Good morning, everyone. This is cool to be here, but I'm throwing something out that's sort of outside the box, but I'll give you a little backstory. So I got transferred to the Harrison district, and it was one of my first meetings, and it was like right before the pandemic hit. And my wellness rep asked me, he said, we're having an all hands. He's like, hey, can I make an announcement? I said, yeah, sure, Nick. Nick from Harrison does a nice job promoting wellness programs. And he announced that they were putting a little team into a Spartan race. It's like a obstacle course on a mountain CrossFit event. And we started to have banter. I said, is everyone invited? He said, sure. I said, we'll put my name on the list. And I never did one before, and I certainly wasn't prepared for it. But putting that date on the calendar, I had to train for it. And, you know, a bunch of us went, we had a blast, which is pretty cool. So you have your wellness rep promoting a wellness event, and you got people doing things that they otherwise wouldn't, right? So since then, I've become obsessed with races, and I continue to do it. So I'm doing it on my own, and I just flew to Jacksonville, and I thought, you know, as we're coming back and as we're able to do more things, there may be opportunities to put things out there as a team if people are into CrossFit events. And it's not for everyone, but it's certainly for this guy was something that I never intended on doing, and now it's like become a thing. So now I keep like raising the bar because they have different levels, and I have a Spartan Beast on the calendar that I'm trying to train for. So that's an idea that perhaps as a wellness community, we could do like an event and put teams in. I'm just throwing that because I know that there's ones coming up, and there's the one in Jersey that probably would make the most sense. There's one on October 1st in Vernon. So that gives you enough time to like promote it and put it out there. And then another thought I had is, and again, I do this every year with like my son, my nephew. There's a thing called the Murph Challenge, which is it's a CrossFit kind of event for our military, and there's a huge backstory with it. That's a little bit less of a timeline, so I don't know if we could pull that off. But what that is you run a mile, and then there's a requirement for 100 pull-ups, 200 push-ups, and 300 squats. And you could do those in any variation. Like you could do 5 pull-ups, 10 push-ups, 15 air squats, like 20 sets, and then you run another mile at the end. But again, that's a cool event that like CrossFit communities come together for our military. So I'm just throwing it out there that as we're coming back and as we're able to do more things, there could be opportunities to do like extreme challenges. And I guess there's some things, you know, like when you go to a Spartan race, you have to sign a waiver. That's between you and the Spartan folks. And it's like, hey, this is on you if things go awry. So I guess there's some things we would have, for a company, we'd have to make that distinction from a liability standpoint, I guess. But again, I was a part of a thing that my wellness rep encouraged me to do, and maybe that's something that could grow, and I would be more than happy to be part of that if we were looking to embark upon such an endeavor. And I know like Megan Merdinger, she does these things called Ragnar relay races, and that she sent some footage of that, and I'm not a big runner, but that's a really cool thing too. So I'm just throwing it out there. There are some extreme, and it's not for everyone, but maybe across the company, you may get a couple folks to represent PS on some cool wellness activities. And because when you put a date on the calendar, that date is coming for you, and whether or not you're prepared is on you, because you have to get yourself ready, because it's difficult, and I'm not able to do every single one. The rope climb still evades me. Again, I'm probably droning on too long, but it's just an out of the box crazy thought. I said to Amanda, I have a crazy idea. She replied, of course you do, because she knows me well enough. So again, I'm just throwing it out there to the wellness folks that, you know, maybe that's something we can consider for down the road. End of report.
We appreciate that, Mike. I mean, it is a good idea. I know, just like, once again, kind of a hybrid thing that we were doing is some people in my location, or, you know, in Southern, we kind of use Nike Run Club to log miles. And then, you know, at the end of the week, you know, it was like a winner. Now, mileage may vary, right? But you could kind of create your own, like we already created our own pool where some of us would meet for dinner, and it was like, okay, well, the lowest person or whatever has to pay, you know, has to pay the kind of the tab, or everybody or something. There's a lot of different ways to kind of approach it. So no, I definitely think that's a great idea. I see a couple of questions in the chat. Is there a template file for self-reporting exercise session documentation? Amanda, do you know?
Jen is prepared to answer that question. I'm working on Doug's.
Okay, yeah, I see that. I see that one. Okay. All right.
Go ahead, Jen.
For that one, you could check off that you completed the 100 sessions, and then you could always also then list them out. There's no template form for self-reporting, but if you just list out your sessions, that could suffice.
Did that answer your question, Cody?
He's there somewhere.
He's good.
Got it. And you said you're working
I
on the
I
other
will read.
question.
Yeah.
Okay.
I'm going to read Doug's question just so that everyone in the room is aware of it. Doug is down at Nuclear. Since COVID, the salad bar was taken away. Of course, grab and go is available, but and Kathy, this is surprising to me and you, mainly burgers and fries. I already had words with Bob Porter about the Danish in the morning. Is there anything we can do, Doug asks, or contact to try to have more availability open for healthy options? That's the first step. The second would be any kind of initiative to buy healthy options from the cafeteria. It was almost double the price of a burger to get a decent sized salad. At least at the Hope Creek cafeteria, they have little to no salad options. And Doug, this was the place to raise that, because that's how it gets on the list of things that make Kathy and Amanda mad, and then we start yelling at people. And it's really funny to watch us yell at people. But your point is 100% valid, especially at a nuclear location where there's nothing for 30 minutes. And the Wawa is the next closest place where you can get something remotely healthy, and it's still Wawa. I do love me some Wawa down there. So great point. I actually copied and pasted your chat word for word, Doug. So I have a feeling Kathy and I will be speaking with Bob Porter. He's our friend. He may not be after this conversation, but your point's extremely valid. So thank you for bringing it up. That is a quality roundtable. Not that the others weren't. That was a quality roundtable.
Did anybody have anything else for roundtable? Okay. Going once, going twice.
Hello.
Yes.
Real quick, sorry, I just had a question again. Just what Mike was mentioning about all these events that are coming up. I know we done the March of Dimes, we did American Lung. I know that's coming up next month. Are we still part of? Are we still doing these events? The Light the Night Lymphoma Walk. Are we still doing these events? And where can we find information how we could participate in these events? Because I know I've done the March of Dimes probably 4 years in a row. I enjoy it. The shop enjoys it. All the guys enjoy it. And it brings a great atmosphere, hanging out with our coworkers outside of work. And like Mike was saying, when you put an event up and guys are into now, we're getting more into fitness and exercise and being in better shape and taking care of ourselves. When we put these events up on the wall, I mean, it just brings up some sense of urgency to like be more healthier, think more healthier. So is there a place where we could find out when these events are coming up? Who can we contact?
Marlon, that is a great question, and something that I don't think I was able to talk about with the council previously. So for those, pre-2020, so like 2019, we used to have Be Well in the Community on Virgin Pulse. And that was where you would go and sign up for races and events. As 2020 was starting, we were making a transition. And then there were no events to post anyway. So what were we going to talk about? Corporate Citizenship, which is the volunteer arm of the company that provides support to the community. They wanted all of our events to go through a little website you've heard of called Power of Giving. This way, all the things that you do are then counted as volunteerism. And that's a good thing for us as employees, as people who are paid by the company. It's a really great opportunity. So now you're going to find all of your volunteer opportunities in there. So they wanted to do, how we got the free 5Ks. Marlon, you were talking about like the stair climb in Newark with the American Lung Association. All of those will now be posted in Power of Giving. So that's where you're going to find like those spots as these things become available again. And Jen, this makes me think I'm not even sure that we have a direct like Power of Giving link on the Be Well program page. If not, let's do that. I know we have Corporate Citizenship, but maybe we just call it Power of Giving and make it even clearer. But Marlon, does that kind of make sense? Like, well, now we're all filtered into one spot, and so you'll be able to get your spots right from Power of Giving.
Absolutely, and it makes it a lot easier because everyone asks, where do I sign up? And everybody has to go through this and that just to get to, just to be able to sign up. So that Power of Giving, I'll go on it, and then I'll see if I can relay that information to the guys. But do you know of anything that's coming up in the next month? I know there's the American.
I don't.
Okay.
Yeah, so March of Dimes was always sort of more so managed by the utility as opposed to like the corporate arm of Corporate Citizenship. And for those of you in the utility who may know more about March of Dimes, by all means, Light the Night was managed by the corporate arm of Corporate Citizenship. As of right now, I'm not aware of public affairs. That's where we would get the 5Ks, like Teterboro and stuff like that. That's where those come from. I think they're probably just getting started with some of that stuff, as things are opening up a little bit more now. So it's a good question at the right time because it's probably about to explode in a positive way.
Great, good. Thank you.
Oh, and Jen wants to bring up the blood drive. Go ahead, Jen.
Currently, right now, there is the blood drive that's ongoing throughout 2022. So there will be no on-site blood drives. We are just doing a virtual blood drive that you could actually go to Power of Giving, sign up for a day, and then you will follow the instructions to sign up through the American Red Cross. Once you complete your blood donation, you'll receive 500 points via a voucher code later on within the year. So I do have the QR code there too for Power of Giving.
Cool. And team, I'll make sure Jen, when she sends the like deck and everything out, that the Power of Giving hyperlink is in her notes there.
Yes.
Cool. Quality roundtable, y'all. You're all good stuff.
Yeah, very good stuff. Anybody else with any other questions before we sign off? All right. We're still, as always, discussing, the meeting in person. We definitely have some good stuff to look forward to. We always appreciate input and feedback, whether that comes from, directly to me or Amanda or Walt or Kathy or Jen, the Be Well team, whatever form that kind of takes, we all communicate on a consistent basis. So if you see anything that, or come up with any ideas, please let us know. Definitely good meeting today. I appreciate everybody joining in. And as you can kind of see, our next date is, June 23rd, 2022. We'll try to get, make sure we get the notice out a little bit quicker this time or this next time. But I appreciate everybody joining in today. And I hope to talk to you all soon. Thank you.
Bye. Bye-bye now. Bye. Bye-bye.
Have a good
day.
Have a
Bye.
good one, everybody.
Bye-bye now.
Bye now.
Bye. Bye-bye. Have a good day. Thanks for flying. Bye.